Welcome to episode 3 of COVID Weekly. My name is Dave Fiola. I am an associate professor here in pharmacy practice and science at the University of Kentucky College of Pharmacy. As always, my co-host is here, Dr. Craig Martin. He's also on the faculty at the College of Pharmacy with me, and he's an infectious diseases expert. Craig, are you excited for episode 3?
I'm really excited about who we have with us today. The first of our guests today is fellow faculty member at the UK College of Pharmacy, Brooke Hudspeth. Brooke is a graduate of UK and recently came back to join our faculty after spending the early part of her career with Kroger. She serves as the Chief Practice Officer for our College of Pharmacy at University of Kentucky and has been instrumental in our response to the COVID-19 pandemic. And also joining us today is another UK alum, Joel Thornbury. Joel is, as I mentioned, a graduate of UK and owner of Nova Pharmacy in Pikeville, Kentucky. He's got a long history of involvement in pharmacy organizations and has previously served as the president of the Kentucky Board of Pharmacy and currently serves as the president of the Kentucky Pharmacists Association. Since our listeners can't see Joel, I will tell you that he and I share the same hairstyle, sort of a less is more situation going on. Joel and I have been friends for a long time, and I know our listeners will appreciate his community pharmacy insight. So that's where I'm going to start. I'm going to kick it off with Joel. So Joel, as I mentioned, and our listeners just heard, you're an independent pharmacy owner in Eastern Kentucky, which unfortunately has some of the nation's highest rates of health disparities. And over the past year, those same health disparities have plagued parts of Appalachia, not only Kentucky, but other parts of Appalachia for a while, have also been responsible for some of the health disparities in outcomes regarding COVID-19. And so I wonder what it's like for you, what it's been like for you as a healthcare worker and as a leader in your community to experience the past year with COVID-19 in that area.
Well, first, Craig, I want to thank you and David for having me. It's always a pleasure to get this opportunity to share some of the insights that I've garnered over the years and what I get to do on a daily basis. And also, reconnect back with the college and those type of things. You come from something and you go out and you learn and then you bring what you've learned back and hopefully improve those people and the experience going through it. And it's been good to interact with you all, especially during this pandemic, but as always, because we never really go away, especially when you're someone like myself that's involved in the profession as much as I've tried to remain. No one prepared us for what we've seen the last year. We've gotten, I can go back and look at news reports, but no one prepared me in saying that pharmacy was going to basically be a pivotal profession or individual with where we've been. This COVID-19 pandemic and everything that we've experienced since this inception or really hit us with the news has been, in our world, educational. The pharmacist has become a more key person back here in Eastern Kentucky, especially in rural Kentucky, as we are now. Kentucky is fortunate that we have a large population or concentration of pharmacies in our rural areas, and you see more pharmacy deserts in the urban areas than you do in the rural areas. And myself, my patients have learned to live or lean on me more to not only get quality information, with social media being what it is today, and so many spins on this virus. There were people calling me, and there people still are calling me to sort of validate with the information they're getting. Pharmacists have, especially with patients in my practice, it's been one of those, let's be patient. Let's let science and technology guide us. And where we are today is, less than 12 months, we're light years ahead of where they were from 1919. The pharmacist, at least myself, and I say the pharmacist because, all the colleagues that we have back here have been really doing the same. We become, focal points. We have to help these people understand that not being in an establishment during their religious practices is not the end of the world. try to understand what physical distancing is. We understand and respect viruses and bacteria, and a lot of our patients just take it for granted because they've been able to live their daily life. So it's been an exciting time. It's been a very stressful time, but it is something that I think, being a pharmacist for almost 30 years, that's the only part that's prepared me for what we've had to go through.
I think it's interesting that we're talking about Eastern Kentucky, but we have listeners from different areas, and to hear you talk about what the pharmacist's role has been in your practice, I think really you could be talking about that in any rural area across the country. And it's really the pharmacist in a lot of those areas that is sort of there for folks to come ask questions of. And you mentioned education, and I think that's incredibly important. And that's something pharmacists, I think, don't often get a lot of credit for. And they're just sort of there doing their job on a daily basis. So it's really been pretty inspiring to see some of the stories of the pharmacists that have been involved. And I'm going to turn to Brooke now, and that's a great segue going into what Brooke has been doing. You've been leading some of the vaccine efforts here in Central Kentucky, and it's been really impressive to see the logistics that go into vaccinating thousands and thousands of people. And I think if you look at an operation that big, it's never going to be perfect, but we've gotten a lot of folks vaccinated in a short period of time. Not enough, but a lot. I wonder if you can help us understand some of the challenges maybe that you and those planners have had to overcome as we roll out those programs.
Yeah, thanks, Craig. So you said it perfectly. I think all of the logistical considerations with this particular vaccine rollout has really presented the biggest challenges that we've seen thus far. As Joel mentioned, pharmacists are critical parts of their communities and are able to provide immunizations and have been doing so for several years. But I think as we look at this particular rollout, and just the vast number of individuals that we need to immunize, that really has led to some challenges that we've had to take a look at and to overcome. So I think when we think about those logistics, just like I said, as you can imagine, with the development of this new vaccine and the number of individuals that we are aiming to vaccinate, the supply has been and will continue to be an issue that we have to consider, especially as we first get started. We know that the U.S. supply specifically is limited, has been limited at first. And when that vaccine supply is limited, it is offered in a phased approach. And so we use the CDC recommendations that they've provided to our federal and our state and our local governments about who should be vaccinated first. And these recommendations are well validated. They are based on recommendations from the Advisory Committee on Immunization Practices, or ACIP, which is an independent panel of medical and public health experts. Eventually, we will ensure that everyone gets vaccinated, or at least that's our goal, as many people as possible. But until we have that supply, we have to work through those recommendations and follow our specific state guidelines, which, by the way, may look different from state to state a little bit, and really figure out how to best provide that vaccine in that structured approach to ensure that we are meeting those guidelines and immunizing those most vulnerable patients first, as well as our essential personnel, such as healthcare providers and others who are critical to the functioning of society. And also think about some of those groups that may have higher health disparities because of COVID-19. Another logistical piece that we've had to really think through is the supply and the storage. So we think about vaccine, particularly COVID-19 vaccines, the supply chain, especially in terms of storage for the vaccines that we have available, has definitely presented one of the most significant challenges in the widespread distribution. of the vaccine. So the unique storage requirements, especially if we think about the Pfizer vaccine, for example, that requires the ultra cold storage, can and has proved to be a limiting factor in that widespread distribution. I know many pharmacies have actually began preparing early. Many even purchase special equipment and these ultra cold freezers to be able to provide the vaccine. So those logistical steps have really proved to be a bit of a challenge that we've had to think through. And maybe if I could say a third logistical consideration would be the workforce. And we have several pharmacists and other healthcare providers who do stand ready to support these efforts. They've demonstrated this already. But what we've also seen is a wealth of employment opportunities, especially in pharmacy, as we think about the need of personnel to be able to vaccinate that large number of individuals. And then additionally, the process is a little bit different. So while pharmacists are very well versed in providing immunization services, this product itself, COVID-19 vaccines itself, the processes are different as far as receiving the product, how it is distributed, the documentation systems that are required, reporting of the data. So really just figuring out that process has been a huge undertaking. And as with any new process, there will be, and there have been bumps in the road. As you can imagine, these brand new models that are really unprecedented, as they're implemented, we're definitely going to have room for improvement and be able to identify areas where we can see that improvement. And so our team, I know specifically, has continuously been refining the process to be as efficient and as streamlined as possible.
Yeah, Brooke, and it's really been amazing to me, being in some of these vaccine centers. I've just looked around and been awestruck by, the amount of logistics that really had to be thrown together in a very short amount of time. And, another thing, just looking around at how many people are really out of their own generosity volunteering their time to go and to be a part of this huge effort. So it's really been a cool thing to watch, for sure. So I know, just like all of us, you're a huge advocate, obviously, of getting everybody vaccinated. And even though we've been saying how important it is to get vaccinated, and, this is really going to be the tool that allows us to get back to normal society, we still are seeing a lot of hesitancy, of course. What do you think are the major drivers of this hesitancy?
So, yes, I have been providing vaccines, helping to lead vaccine efforts, essentially for my entire career as a practicing pharmacist. And throughout those years, I have certainly seen the hesitancy that you mentioned, even long before COVID-19 vaccines, right? So I think there are many drivers to the issues we see with vaccine confidence. Misinformation, I would say, is probably one of those biggest drivers. There's so much that is out there that it can really be difficult for individuals to sort out the false information from the facts. Another driving factor that I feel is really present is mistrust. And so, especially as we think about certain historically disenfranchised communities, we really see that mistrust there. And if we think about why this is, sadly, there is a disturbing history between Black Americans, for example, and American medicine. And so it's easy to understand the hesitancy from these individuals. And this is really an area that certainly deserves increased focus. And additionally, I think there is lack of confidence. If we think about COVID-19 in particular, we know the rate at which these vaccines were developed was quicker than normal, and their availability as well. Also, the unique technology of the vaccines think all of this has really led to some questions for the public about, or for certain individuals about the safety and maybe the implications of these vaccines. And so if individuals don't know or receive accurate information about the steps that were followed throughout the entire process to ensure safety, or without them knowing the level of scrutiny in terms of safety and efficacy, really, that these vaccines development processes have followed, individuals will have some degree of hesitancy, I think.
Yeah, absolutely. So do you think the big approach here to overcome these issues is just continuing to communicate and educate about this vaccine and its safety? And obviously there's going to be more and more data coming out as we go. Is that the big avenue, or are there others in your mind?
Yeah, so yes, I think providing the education about vaccines, sorting out the myths from the facts is very important. But I also think that building trust is especially important. And even more so in these patient populations that are already facing disparities and have been historically disenfranchised. So I think one of the approaches that we might be able to take is really working with leaders in the community to identify what those barriers are, what those needs are, and then really partnering with those communities as healthcare professionals in these efforts. I think that's going to be really important to overcome these issues.
So, Brooke, I like a couple of things you said there. In one of your previous answers, you talked about the requirements for the distribution plan not being the same from state to state. And I saw a graphic on the news a few nights ago about how many states had prioritized teachers above what they would have been prioritized otherwise. And I'm really proud to say that Kentucky has prioritized teachers, but I was really fascinated at how many states had not. I think it was just over half had prioritized teachers above what they would have been otherwise, given their age and health conditions, et cetera. So I think that's, to me, I think they should be a little bit higher. I come from a family of educators. There's several teachers in my family, including my sister, who's an active teacher right now. And so I'm really happy that she was able to get vaccinated here in Kentucky. So I'm going to first, I'm going to put in a plug for one other podcast episode that I listened to not long ago. And this is a podcast that's been around since the beginning of the pandemic. It's called In the Bubble. But on the February 22nd episode, there was a really good question and answer session with a couple of epidemiologists about when will we know what we can do, right? So some of us have been vaccinated because of our healthcare status. Some of us have been vaccinated because we're teachers. But a bunch of folks in our community have not yet been vaccinated. So when will we begin to do that? And I want to point our listeners to that episode and say, one of the things I took away from it is not going to be flipping a switch overnight. It's going to be a slow trickle of things that you are going to be able to feel comfortable doing as you get back into society and more folks around us get vaccinated. So I'm going to turn over to Joel for a second. And I'm going to ask Joel to talk about his confidence in vaccine availability in rural towns. And so whether that's as we open it up to more and more folks, are you confident that we're focusing enough on people outside of our largest cities and towns to be able to get them access to the vaccine?
Craig, that's a great question, and really sort of taken in many different steps. As Brooke mentioned earlier, this is the first time we've ever really done this. We've rolled out vaccine programs, and we all know the importance of vaccinations and disease prevention. But this is the first time we've tried to vaccinate, 300 million or 3 million people if we vaccinate 60% of Kentucky within a 4-month period. We've never done it before, and thus we're learning things from day to day, steps to steps. We're scientists and we study things and we make a change. We make changes. The biggest key that we've seen to this point, and Brooke made reference to it earlier, is just the sheer lack of availability of vaccine. I do feel confident that we will get to the point to where we get sufficient vaccine into the rural area. I think that the the logarithms that have been applied are applied to the population masses, which is why you see most of the regional areas initially in your urban areas. But as the state did what it best thought when it rolled out to your 31 sites around the state that had capabilities for housing or holding the vaccine. One of our vaccines that's available requires a negative 70 degrees storage, and that just can't happen in a lot of the rural areas. But we have gotten some facilities that have stepped up. Our regional hospitals, and I say regionally to Eastern Kentucky, it's nothing like what we see in the larger cities, but to a smaller scale, with Pikeville Medical Center, ARH back in this area. I know that Baptist has stepped up, and you start to go back out west or central Kentucky, depends on how you want to look at it. And our health departments have done for all they can with what we've had. I think that we'll get to the point to where rural coverage will, I don't even know if it'll catch up. It might exceed how well we do in urban areas. Now that we've gotten through the point where the state distribution is sort of continuing, and now we've gotten some federal assistance or federal boost, and now we've instituted another 200 pharmacies almost statewide, where those distributions or those points of vaccination will be going out to the public. And that's where the rural areas will hit largely, because we're gonna hit a point here in the next, I would say, 4 to 6 weeks, when all the people want to go get vaccines. There's going to become a point where we've got to go seek them. These people are looking for a vaccine, so they're coming to us in droves. I want to get vaccinated. But then there's going to get a point, and it goes back to the misinformation and some of the stereotypes that Brooke referred to, that we're going to have to go out and seek these people. And that happens when the vaccine gets down to our level, when I can get 100 doses a week, and I can go put those into my patients that either had concern. I want to get vaccinated. Well, I want to get vaccinated if you're vaccinating me, Joel, but I don't really feel comfortable going, to the university or going somewhere else. And those type of people, we've got to get that percentage out. And I think that as we roll out into the rural areas with this federal program and more distribution sites, that's when I think that we will have the rural areas pick up and really be represented in getting this vaccine program going. But again, what I tell people, my patients, the people I interact with, and whether it be healthcare providers or political people, we're learning day to day. We're making adjustments day to day. And because we are laying science to this, and trying to keep politics out of it, we will improve it day to day. And we just have to continue to have patience with it.
Yeah, Joel, that's a really fascinating point you just made. And, in addition to your role as an independent pharmacy owner, you are also president of the Kentucky Pharmacists Association. So the point you just made about that personal touch of having your own patients and reaching out to those who you, in one example, or anybody really in a retail pharmacy, the patients that they serve, and reaching out and reaching them to increase those vaccine numbers as we move through the next few months. How do you see that role for independent and retail pharmacies and pharmacists throughout our communities? How do you see our ability as pharmacists to really make an impact here in the coming months?
Well, Dave, I'm not quite sure there's another profession out there that can have as big an impact as we will with this COVID vaccine rollout, or as we do in healthcare. We know a little about a lot, and we have a lot of contact with patients, and thus we build relationships. I mean, these patients are my family. And even if you have a pharmacy down the street, then I'm working through you or with you to work with your family, which are your patients. I think pharmacists will be key moving forward, because we'll be able to identify those patients that either need some assistance in working through the lack of their modern technology. One of the hurdles that we've learned over the last 3 weeks or 4 weeks is, we want everyone to register through a portal on the internet. However, there are a lot of our patients at the most, vulnerable age that don't have internet access. And so they've had to go they either walk up or they call and go, I want to get registered, but I can't register.
Right.
And so having that one-on-one, or, having that relationship existing, will make it pivotal for pharmacists, especially in the pharmacy, community pharmacy practice, whatever that practice may be. Whether it be at a Kroger or a Walgreens or Nova Pharmacy or anything like that. Pharmacists will be one-on-one, and that's what really makes our profession unique, especially with this rollout, but also in healthcare overall.
Yeah, and that I think ties also back to the points that we made earlier about education. Brooke, do you have anything to add about the pharmacist role?
Yeah, I'll just echo what Joel said as far as pharmacists being well positioned to be able to really support these efforts. So, like we mentioned earlier, pharmacists know vaccines. They've been administering immunizations for over 25 years, and they know what it takes. So, who needs to get a vaccine? Those appropriate screening questions, the appropriate storage, handling, the administration technique. How to communicate with patients. So we talked about the education and the vaccine confidence piece, and pharmacists have been trained to be able to provide that education and work with patients. And then additionally, as Joel mentioned, we know that pharmacists are trusted healthcare providers in their communities and pillars of their communities, especially in those rural and underserved communities. You may have heard the statistic, but almost 90% of Americans live within 5 miles of a pharmacy. And so we know that they can answer questions and be there to help dispel those myths, to really help be extenders of that public health messaging, and help with that patient confidence in receiving the vaccines. And as we think about, we talked a little bit earlier about workforce and, that being one of the logistical pieces that we've really had to work through. But I think the most recent numbers I have seen is that there are more than 376,000 pharmacists and student pharmacists that have been trained to administer vaccines to patients across the lifespan. I know at the University of Kentucky, for example, we even pushed that up a little bit in our curriculum so that our first-year pharmacy students could go ahead and begin vaccination efforts through their training even a little bit earlier, to really increase that workforce even more. And additionally, what we're also seeing is some expanded opportunities for the pharmacy workforce. So with our pharmacy technicians, for example, and some extended opportunities they have been given through HHS guidance through the PrEP Act. And in fact, the technicians that have been trained, I think that number is up to about 30,000 technicians that have been trained in vaccine practices and in immunizations, really as a result of this expanded opportunities for technicians to help with these efforts. And so really what I think it comes down to is that, pharmacists have already been leading these efforts across the country. And while that model may vary slightly state by state, I think what we've seen is whether it is a chain community pharmacy, an independent community pharmacy that are immunizing high-risk patients in the long-term care facilities, whether it's a hospital pharmacist that is leading their health systems vaccine efforts, or our student pharmacists and faculty from colleges of pharmacy that have partnered with the state departments of public health to vaccinate the community. We have seen pharmacists really step up to serve their communities during this time.
Well, and I'll follow up with that, Brooke, and I'm going to step in here real quick, Dave. The Kentucky Pharmacists Association has been working really behind the scenes since before this began. We fortunately in this state have a pharmacist that works directly with the Department of Public Health. And so that's one of the keys that we have that other states around the United States have not taken with the federal rollout by incorporating a lot of community pharmacies into this next phase of rollout, because we see in a state as rural as Kentucky can be that it's going to take a lot of focal points and at a slow onset, just so we don't create confusion amongst the masses of where they can get it to basically get the job done. And so the pharmacists in this state are prepared behind the scenes, in front of the scenes, and hopefully, as we go forward.
One of my main goals of having the two of you on today was that, we've had an episode on the virus itself. We've had an episode on the technology of the vaccine, but I really wanted to let our listeners in the public know one of the ways that we plan to get the vaccine into their arms, because we can talk about the virus and we can talk about how amazing the work has been to get the vaccine to us. But then we got to get it in people's arms. And I know the last couple of flu seasons, at least, actually more than that, I've been vaccinated by one of my current or former students. The other day, I was vaccinated for COVID-19 by a nurse from UK Healthcare. I'm looking forward to the day that we can walk in, that I can give someone a piece of advice that they can walk into their local pharmacy and ask for their COVID-19 vaccine. I think that day is coming. I think the two of you have given us a glimpse of the roadmap that it's going to take to get there. And I'm impressed with what both of you do on a daily basis. And I'm really thankful that we were able to have you on this episode. I'm really thankful that you chose to spend your time with us.
I'll add this, Craig, is that I know that when this began, that the pharmacy community within the state realized that we were going to play a key role because we realized that more vaccinations in Kentucky are provided by pharmacists than any other providers combined. Therefore, I will also tip my hat to, and you were on there at the time, the Kentucky Board of Pharmacy, for coming to the table along with all the other organizations to get us aligned and really trying to work from the same script. Even though we have to do it in different manners, because we all knew, not just the oath we took, that the patient was the center of our world, and their health and well-being was key. So
I think if there's ever been a time in our lifetimes for all of our healthcare professions to work together toward a common goal, this is it. And I've been really happy and excited to see what folks are doing. So again, thank you. I think this is a great way to end it for episode 3. And I look forward to seeing you guys in person fairly soon. Have a great day.
Thanks to both of you. Take care.
Thank you.
Thank you.